Sarah becoming Sam or Jim becoming Julie. It's not an easy process. Identifying with a gender different from the sex you were assigned with at birth can be difficult. Let's have a look at the disorder with gender identity. Gender dysphoria. It is a condition where a person experiences discomfort or distress because there is a mismatch between their biological sex and gender identity. It is sometimes known as gender identity disorder or gender incongruence or transgenderism. Types: body dysphoria, social dysphoria, and mind dysphoria. Body dysphoria or body dysmorphic disorder is an anxiety disorder where individuals spend time worrying about their physical appearance. These individuals also have a distorted view of their looks. Body dysphoria may occur in individuals who already suffer from other mental health disorders, such as major depression and anxiety. Social dysphoria is the distress and discomfort that occurs due to how society views the individual. A few contributing factors include when other person assumes an individual's gender, uses incorrect pronouns, or make assumptions about social roles concerning gender. Mind dysphoria, usually experienced by older patients. Mind dysphoria describes an individual experiencing feelings that are related to their assigned gender or the one to which they no longer relate. An example would be an individual who identifies as a male but experiences premenstrual syndrome symptoms. They do not want to feel these emotions. Symptoms: gender dysphoria in children. Children with gender dysphoria may exhibit separation anxiety disorder, generalized anxiety disorder, and symptoms of depression. The child may feel out of place between their expressed gender and the gender with which they are born. This conflict is usually present for at least 6 months with the following potential symptoms: desire to be of the other gender. In boys, a strong preference for wearing girls' clothes. In girls, a strong preference for wearing only masculine clothing. Depression or anxiety. Clinically significant distress or impairment in major areas of functioning such as social relationships, schools, or home life. Symptoms in adult. Adult with gender dysphoria may display symptoms of anxiety or depression. Adult males may have abnormal sexual desires. Adults may also feel out of place in their assigned gender and the anatomy that comes with it. Symptoms in adults that differ from children include strong desire to be rid of one's biological gender characteristics, a strong desire to have the sexual attributes of other gender, a strong desire to have a medical procedure to become the other gender, and a strong desire to be treated like the other gender. Causes. Most professionals do not know what causes gender dysphoria. Genetic. The development of gender is a process that starts before birth. In fact, it begins at conception. When one sperm succeeds in fertilizing the egg, the genetic makeup is determined at that point, and it may have a bearing on your future gender identity. Hormonal causes. During and after birth, hormones continue the process of gender development, but hormones are often quite variable, depending on many biological factors. All these differences are part of what makes you the gender you are inside. Diagnosis. The diagnosis of gender dysphoria is a systematic process. History taking. Your mental health professional will take your medical, family, and personal history first. This gives them a foundation for understanding more about your biological gender. It also lets them know about some of the issues you might be dealing with in your life. Behavioral health evaluation. After finding out about your history, the next step is usually a diagnostic interview. The therapist or psychiatrist asks you questions about how you think and feel about gender. They may ask you how you react to situations that are commonly associated with one gender or another. They will want to know whether you have strong desires to be or express a different gender. And they will ask you how your experience of gender is impacting your life. DSM-5. Mental health doctors and counselors use the DSM-5 criteria to compare your dysphoria symptoms to accepted criteria for diagnosis. If they determine that you do indeed have gender dysphoria, they will usually recommend treatment options. Management. Medical treatment of gender dysphoria may include hormone therapy, such as feminizing hormone therapy or masculinizing hormone therapy. Then surgery, such as feminizing surgery or masculinizing surgery to change the chest, external genitalia, internal genitalia, facial features, and body contour. Behavioral health treatment. This treatment aims to improve your psychological well-being, quality of life, and self-fulfillment. The goal of behavioral health treatment is to help you feel comfortable with how you express your gender identity, enabling success in relationships, education, and work. Support may also include affirmation in various domains. Social affirmation. It may include an individual adopting pronouns, names, and various aspects of gender expression that match their gender identity. Legal affirmation. It may involve changing the name and gender markers on various forms of government identification. Along with that, other ways to ease gender dysphoria include peer support groups, voice and communication therapy to develop vocal characteristics matching your expressed gender, then aesthetic services such as makeup application or wardrobe consultation, then social and community services to deal with workplace issues, minority stress, or parenting issues. Hope you like this video on gender dysphoria. Please subscribe the channel for more videos on related topic. Thank you. Keep smiling.